Welcome to today's episode. We're diving into a topic that's been a persistent global health challenge, tuberculosis, or TB. It's been around for centuries, yet eliminating it remains a daunting task.
Absolutely. TB is one of the oldest known infectious diseases, yet it still claims over 1 million lives annually worldwide. The article I read highlights several challenges in eradicating it. Did you know India alone accounts for nearly 27% of global TB cases?
That's staggering. And it makes sense why India plays such a critical role in global TB elimination strategies. But why is it so hard to eliminate TB? We've made advancements in medicine, haven't we?
True, we have effective treatments, but the challenges are multifaceted. For one, there's the issue of drug-resistant TB. Imagine trying to treat a disease where the bacteria refuse to respond to antibiotics.
Right. Multidrug resistant TB, MDR-TB, is a major hurdle. It complicates treatment and makes it far more expensive and time-consuming. But it's not just biology, is it? Socioeconomic factors play a huge role too.
Oh, absolutely. Poverty, malnutrition, overcrowding. These are some of the key drivers of TB. In many low-income settings, people lack access to proper healthcare systems. That's a recipe for prolonged transmission.
And then there's the stigma. TB isn't just a medical problem, it's a social one. Many people fear being ostracized if they're diagnosed, so they avoid testing or treatment altogether.
That's such a crucial point. Stigma is like an invisible barrier to progress. But let's not forget the technical challenges like diagnosing TB. Did you know that TB symptoms often mimic other respiratory diseases?
I did, and that delays diagnosis significantly. Plus, traditional diagnostic tools like sputum tests aren't always reliable, especially for detecting TB in children or people with HIV.
Speaking of HIV, the co-infection rate is alarming. TB is the leading cause of death for people living with HIV. It's heartbreaking to see how these two diseases amplify each other's impact.
Definitely. But there's hope, right? The article mentions innovative approaches like using molecular diagnostics and vaccines like BCG. Though BCG isn't perfect, it's still a step forward.
And research into new vaccines is promising. If we can develop vaccines that offer better long-term protection, it could be a game changer. But scaling that globally will take significant investment and political will.
Which brings us to the role of governments and global organizations. Funding is critical, yet many TB programs face budget cuts, even though the disease burdens remain high.
That's frustrating, isn't it? Especially when TB elimination is part of the UN Sustainable Development Goals. We're supposed to end the epidemic by 2030, but are we really on track?
At the current pace, it seems unlikely. But advancements in technology, better awareness campaigns, and partnerships between public and private sectors could accelerate progress.
True, collaboration is key, and addressing the root causes, poverty, malnutrition, and stigma, alongside medical interventions will be essential. It's a tough fight, but not impossible.
No doubt. Well, that's all the time we have today. TB elimination may be a challenge, but it's one worth tackling for the sake of global health.
Absolutely. Thanks for tuning in. And remember, every step forward counts in this fight. Until next time.